symptoms of Crohn's?
Okay, so you got diarrhea,
Okay.
mouth ulcers.
Yeah.
Do you want histological?
Go on.
Cobblestone appearance.
Oh, okay.
You have
Okay.
yeah, I mean, what else do you want to know? What else do you...
A hypertensive patient develops a dry cough. What was their medication?
Asin.
Yeah. Oh, that was easy. Next. A patient comes in with shortness of breath and hyperresonant breath sounds. What is it? Yeah.
What are the 4 things in tetralogy of Fallot?
Oh, okay. Overriding aorta.
Yep.
Pulmonary stenosis. Wait, hold on. I know this. Right ventricular hypertrophy. And ASD. No. VSD. Okay. Yeah. What is Charcot's triad?
Oh, right upper quadrant pain, jaundice,
Yeah.
and fever.
Yeah. Nice.
Okay.
Okay, so you got a chest X-ray,
Okay.
alveolar back wings, and curly B lines.
Pulmonary hypertension, edema.
There you go, there you go. There you go.
Condition is this, okay? You've got a child with a barking cough. Nice. Also known as?
Barking cough,
No.
laryngitis, bronchitis.
No. Laryngo.
Let's review how to do a lung and breath sounds examination. First things first, introduce yourself and do a general inspection. Next, we want to take a look at body habitus, respiration, eyes, mouth and lips, hands, fingers and nails. Don't forget to check the radial pulse as well as the neck. Next, we want to move on to our chest inspection. We want to look for deformities, any abnormal breathing, and the chest expansion. Move on to chest palpation. Remember to identify any tender areas before continuing. Also do the chest expansion test and check within the axilla of the arm. Percuss the chest in the 6 positions bilaterally. We then want to auscultate in the 6 positions, as well as listen for breath sounds, any adventitious sounds or transmitted vocal sounds, such as pictuoliquy, bronchophony, or egophony. Then move on to your lateral inspection where you look at the AP diameter, important in patients with COPD. Then move on to your back inspection. We're looking at the same things that we did in the front. Move on to back palpation. Again, we want to check for any tender areas before we start, and then we want to check for the lung diaphragm excursion. We then want to also percuss in the 6 positions bilaterally. Continue with back auscultation, listening for normal breath sounds, transmitted vocal sounds, as well as adventitious breath sounds. Finally, we're going to finish off with looking for sacral as well as peripheral edema. You can get these notes for free in the link.
Question. Yeah. What cranial nerve controls taste or posterior third of the tongue?
That's cranial nerve number 9, which I think is a glossopharyngeal nerve.
Yeah, well done. Hey, Fahd, I've got a question.
Hey, yeah.
Give me 3 features of meningitis.
Meningitis, neck stiffness.
Yeah.
Fever.
Yeah.
Just a bit tired.
Just a bit tired?
Yeah.
Hey, Mustafa, I've got a question.
Yes,
Name the 3 bones in the ears.
the stapes, the incus, and the... What was it called?
Go
I
on.
remember the last one.
Time's running out.
Oh, I can't remember.
Hey, Mina, I've got a question. What are the 2 hormones produced by the posterior pituitary?
ADH and oxytocin.
Let's go. Question 1. What is the name of the system that transports blood around the body? Correct, cardiovascular. Question 2. Which is the largest joint in the human body? The knee. Question 3. What is the name of the tissue that connects muscle to bone? Tendon. Question 4. Which muscle group covers the front and side of the thigh? Quadriceps femoris muscle. Question 5. What is the principal muscle of respiration? Diaphragm. Question 6. Which is the largest nerve in the human body? The sciatic nerve. Question 7. Which gland produces tears? Lacrimal. Question 8. Which is the longest segment of the small intestine? Ilium. Question 9. How many tarsals are there in the human ankle? 7. And finally, question 10. Which nerve innervates the medial petragoid muscle? The mandibular branch of the trigeminal nerve. What were your scores? Let me know in the comments.
The subcutaneous layer of skin is referred to as what? That'd be the hypodermis. Where is yellow bone marrow found in a long bone? That'd be the medullary cavity. The pulmonary veins carry blood to which chamber of the heart? That'd be the left atrium. Bonus question, the obturator artery is a branch off of which of the following arteries? That'd be the internal iliac artery. How well do you know your bones? Let's find out. What is the anatomical name for this bone? That'd be the scapula. This is the longest bone in the body. That's the femur. What part of the bone am I looking through? That's the obturator foramen. Do you think this one's funny? It's the humerus. Last one. What's this called? That's the coronoid process. How'd you do?
Asking first year medical students medical questions. Let's go. You've got a pregnant woman with a blood pressure of 170 over 100. What would you give her?
There's nothing you can do. No,
That is one thing.
it's not
There's
being
one drop.
It is. Yeah, nice. What is the mechanism of action for tetracyclines? Stop pretending to pick up a phone call.
What's the first line management for a hemodynamically unstable
أعوذ بالله.
AF patient?
What is he saying?
AF patient.
First line treatment. Is it cardioversion?
Yeah,
Nice. At what point does the abdominal aorta bifurcate?
Oh.
Oh, did we stop the Sam Odland?
He was L4.
Is it L4?
Yeah.
What do eye cells secrete?
Can you not BCK?
Yeah.
Learn how to listen to heart sounds with me.
Today we're going to learn how to listen for our 8 main heart murmurs, as well as learn the 4 valvular areas where we need to listen over. This is going to be extremely helpful in your next cardiovascular OSCE exam. First things first, what we want to learn are the 4 valvular areas. We have our aortic, pulmonary, tricuspid, and mitral. Aortic and pulmonary are in the second intercostal space on the left and right parasternal line. Our tricuspid is in the 4th intercostal space in the left parasternal line, and our mitral is in the 5th intercostal space in the midclavicular line. It's normally located just around underneath the nipple if you don't know where to look. Now that we know our 4 valvular areas, you can remember this by the mnemonic, all physicians take money. First things first, what we're going to do is we're going to take the diaphragm of our stethoscope and we're going to place it on all 4 valvular areas, remembering to use your index fingers to feel for S1 and S2 in the carotid artery at the same time. So we're going to put it in the aortic and listen for 2 to 3 seconds, the pulmonary, the tricuspid, and the mitral. While we're listening, we want to make sure that we time it with our carotid artery so that we can know if the murmur is a systolic or diastolic murmur. This will help us determine if it is a regurgitation or a stenosis. Special maneuvers to remember: if you suspect the patient has mitral stenosis, you need to move them into the left lateral decubitus position, which basically means placing the patient on its side. You will then take the bell of your stethoscope and place it in the exact same position that you did when you were listening to the patient's heart for the first time. This will help. We will then ask the patient to breathe in and inspire, which will then make the sound louder and we'll be able to hear the mitral stenosis better. Another thing we can look for is mitral regurgitation. We would then go to the mid-axillary line, place the bell of our stethoscope, and listen for mitral regurgitation. This helps us differentiate if we think it might be a tricuspid regurgitation. In the original position, and we want to listen with our bell on the left and right carotid arteries for aortic stenosis. Aortic stenosis regurgitates to the carotid arteries, so this is why we would be able to hear it there. And the last one is sending the patient forward and listening in the aortic position.